looks like we're live. So we've got Dr. Shilpa here.
Hello.
And we're on the dot, 2:15, ready to go live, answering all the questions that you guys may have. And thank you for submitting all the questions. We've had a few of them come through. So
I'm very excited.
Yeah, and I'm going to put you on the spot today with these questions, but
let's see what the commonly asked questions are and how I can answer them as best as I can.
awesome.
Bring it on, Mina.
Okay, so I'm just reading through the chat box here. So I've had one question here. So this person says, I had a toothache for about a week, but it stopped. So there's no point of going to the dentist now, right? How would you respond to that?
That's a very common question we get all the time because patients have toothaches and then suddenly when the time comes when they need to attend, the pain goes away and they cancel their appointments. My advice is, toothaches are something where the disease or cavity in the tooth has progressed into a layer called the nerve. So, that can lead to infections. So even though the pain disappears, it can come back a lot more worse and cause more problems in the future. Our main goal is prevention. So prevention is far better than having to treat the disease. So we always encourage our patients to come in for their 6 monthly checks, and we also want to educate them to how to best manage their oral health and how to maintain their teeth better so that there's less problems and less extensive treatment in the future. So if the pain goes away, it doesn't mean it's all fine. It means that it's just waiting to play up again in the future. So don't leave it too late, guys. Thank you.
Absolutely. Yeah. Okay, here's a good question that I struggle with this myself as well. And so this person's asking, how can I get my kids to brush their teeth? It's a constant battle.
Don't we have that battle all the time? I've got a 18-month-old and it's a constant struggle day in and day out. And I'm sure all parents can relate to that.
Yeah, it doesn't get any better at 9 years old either.
Oh, really? I was hoping as they get older they'd be a bit better, but I guess the tips that I would say is there's lots of apps out there that you can download on the phone where it makes it fun and entertaining for the kids as well as the parents, and it has a timer for 2 minutes to remind you that you need to brush for that time, and there's lots of songs that you can play with the kids, and if all else fails, then unfortunately we may have to hold them in headlock and brush them, because the last thing you want is for kids' teeth to suffer, and they're so much more brittle than adult teeth, and we see it all the time. So don't forget to brush their teeth morning and night.
Yeah. And sometimes I just send my son straight back in. If it's less than 2 minutes, he has to go and start over. So don't let them get away with it.
No, not worth the pain.
Yeah. Cool.
Gosh, these questions are so interesting actually, because we hear it all the time, but it's nice to do this Q&A so we can share golden nuggets with all the public out there. So keep those questions coming, guys. We'll be here for a little while yet.
Awesome. So. Yeah. And I've got another question here. Again, this is a very common one. We get asked a lot. So this person says, I get really bad breath. Why could this be?
Oh, bad breath is something that happens to the best of us, and bad breath is because of a lot of reasons. Bad breath can be from a lot of plaque build up because of not brushing teeth properly. Bad breath can be from a dry mouth, which can be due to many reasons, such as medications that a patient might be taking. Bad breath could be from also some kind of an underlying infection of some sort. So my advice is to come and get it checked as soon as possible, because there's different treatment methods for each cause of bad breath. So if you're getting bad breath, do come in and see us so we can advise you on what's the best way to manage that for you. Yeah.
No, I think it's a great answer. Yeah. All right, we've got another 2 questions here. So this next one is about teeth whitening. So a lot of people these days get teeth whitening. So this person wants to know if it's worth it and how long does it last?
That's a good question too, because teeth whitening is something that we do all the time, and I guess teeth whitening can come in different forms, and we do the take-home teeth whitening, which is low concentrated product that patients can take home with some bleaching trays that's custom made to their teeth, which is to be used over a course of a few weeks. Or there's the in-chair teeth whitening, which is the more popular one that we do here, called the Zoom in-chair whitening.
Yeah.
With the Zoom in-chair whitening, it's done as a one-off thing. You come in, it's a long appointment, we pop it on, and it's a higher concentrated bleach as well, which whitens the teeth, and it seems to be more popular because the results are pretty much instant. And
I got mine done recently. So.
Wow, we know. That's great.
Thanks to you.
So yeah, the in-chair whitening is probably more effective, and we see pretty much a few shades lighter pretty much right away. So it also depends on how you maintain them afterwards, because obviously there's certain things you can't do, such as eating stained foods straight away. You want to leave it for a few days at least before you start eating any of that wine and anything like beetroot and coloured foods can affect the outcome or the results. Yeah. So, and teeth whitening is something that can last for a long time. It comes down to, again, maintenance and how well you look after your teeth, and so yeah, I think teeth whitening, there's a few options out there that you can definitely see what works for you as well.
Yeah. Awesome. Cool. Okay, now with this person, sounds like they don't have teeth, they have a denture, and he or she wants to know, is it necessary for me to see a dentist? What would you say to that, Dr. Shilpa?
Oh, that's a very interesting question, actually. Dentures are there obviously to replace teeth, and if a patient doesn't have any teeth and they've got dentures, we still recommend coming in, not every 6 months, but probably once a year, because we still do what's called a cancer screening with every patient. So even though there's no teeth, we do still check the whole mouth and oral cavity to make sure there's no signs of any abnormalities, and we want to make sure that everything's okay. So we do still recommend coming in with dentures so we can just check everything to make sure it's all good.
Yeah. Awesome. Well, I think that's all that time allows for us today. So thanks for our viewers for watching. We can see there's a few of you on there, and we hope this has been helpful for you. And if you have any other questions that you'd like to ask, feel free to comment in the chat box below, and we'll definitely attend to it. Have a great day, guys.
Thank you, everybody, and look forward to hearing from you soon. Bye-bye.
Bye.